go. So, as you would see, I've opened up a couple of things on our screen, and what I'm going to do is show you and go through some of these things with you as we go along. The things on our screen, and what I'm going to do is so that's a bit of a voice echo because the session is going live. So I've closed that. Now, you see three things on my screen. One is a PowerPoint presentation, which we will use always to do the sessions. So this is where we are going to discuss the contents of the unit and obviously look at covering the key frameworks, key models, and obviously the theoretical part of what is required to be studied in that unit. The second bit that you see on my screen is what is called the YouTube channel. So this particular channel that we have essentially has all the videos, all the sessions that we conduct, and they are all broadcasted live. And obviously, I think I'll put it this way, that sometimes it's easier for us to upload them here because, it is accessible to you pretty much, easily by going on to the YouTube channel straight away. So I've dropped a link of this on the chat box as well. Now, after the session has been completed, as you can see, this is being broadcasted live. After the session has been completed, you would see that under the live section, and it will clearly be labeled as, a course, and the unit name will be clearly labeled so that it's easy for you to recognize. So today we are looking at Introduction to Professional Healthcare Service and Practice, and that is the session that you are going to be able to see on YouTube at a later stage, should you wish to revisit this particular session that I'm or the discussion that we're going to do. Now, the other bit that you're going to look at is primarily the Moodle, which is where most of you have got the logins. Not most, all of you have the logins. And when you log into this particular course, what will happen is you go into nursing, you put your username and password, you log in, and what you're going to be able to see is, if I turn and I'll upload this particular part, these are all the units that we're going to study. But obviously what you're going to be able to see is this particular unit, which is going to be highlighted into a yellow box. And this is where I'm going to upload the presentation and the material that we are going to discuss, including handouts, some books, everything that you need essentially to be able to study this particular unit is going to come from Moodle. So this has got two presentations in it, and I'm going to upload the two presentations so that you have copies of these available with you at your end. And later, at a later date, should you wish to, obviously refer to these presentations, they are going to be available up here on Moodle. Now, along with the presentations, I always kind of upload some additional handouts, which are going to be useful for you to read onto this particular unit. And there is also a sampler assignment, which I normally as a practice provide. And that assignment we are going to come to at a later stage. And this assignment will essentially be for your reference purposes only, so that when you complete this unit and we look at discussing the assignment brief, you're able to go about understanding and see a visual representation of how the assignments are to be submitted and how and what evidence has to be created in order to meet this particular criteria. So we are going to do a bit of a holistic discussion on this at a later stage. And this particular assignment also as a sampler, I'm going to upload onto YouTube, onto the Moodle platform, so that you are able to access this and obviously, use it and see it at some stage when you start actually doing the assignment for this particular unit. So let me just put this across as well, and I'll minimize this for now. And that would essentially be a sample assignment for you to look at. So as always, what I will do is, this is just to give you a bit of a background in terms of how you should look at accessing the study material. Most of the lectures will come from the YouTube because it's easier for us to upload them here rather than have it on the Moodle because of the storage space. But they would then be available to you at a click of a button. And as long as you have access to the internet, you will be able to access these sessions pretty much, on the fly. And then the Moodle platform of it would provide the presentations, the reading handouts, the articles, the journals, or anything related to the book that you would need to read up more onto the course. Now, one other thing which I will open and which I would then only share on this screen for now would be the details of the unit that we have got to be able to study this particular unit that we are going to look at starting today. Now, this particular unit, when we look at professional healthcare practice, doing away with the jargon of introduction to and research and all that, what we are looking at is the core essence of studying this particular unit is related to understanding professional healthcare practice. So when we talk about professional healthcare practice, and in general, when we discuss this, what are we looking at covering in this particular unit? Let's quickly put some background in, brief into it. So let me come back to you and, let's look at. So this particular unit is going to be 3 credits only. This unit is not graded. You're not going to be looking at getting pass, merit or distinction. The only grade in this unit is pass. You are looking at some stage when we complete the discussion on the learning outcomes, you're looking at about a 2,000 word assignment plus minus 10%, which is the requirement to be able to pass this particular unit. Now, this unit has 2 assessment criteria. One is to understand what is policy and how policy is created in health and social care sector, specifically in the UK. Now, in the UK also, as you know, we are a devolved nation of 4 countries. We are going to be focusing ourselves on understanding policy around healthcare and development of policy around healthcare, specifically in England. I'm not going to be focusing on Scotland, Wales, or Northern Ireland. We are going to be looking at policy in the context of health and social care and how it is used by NHS, various governmental organizations in the UK to be able to provide services to the members of public and citizens in the UK, and specifically focused on England. Now, it does not mean that I'm going to stop you from reading and understanding this in a broader context across the other 4 nations or other 3 nations, England, apart from England, Wales, Northern Ireland, and Scotland. You would be able to read up, and you should be looking at developing your knowledge in terms of how some part of these policy and policy development and implementation of the change policies happen in other devolved nations. As you know, Wales and Scotland and Northern Ireland, we have devolved parliaments. So Stormont in Northern Ireland, Wales, Cymru, and then if you look at Scotland, Holyrood, they have individual parliaments. The members of parliament in these devolved countries have the ability to be able to set their own rules and regulations. So although laws and legislations and acts which are created are passed in the UK Parliament in London, but they are all applicable in other countries as well, in other devolved countries as well. But there could be interpretations of these and adaptations of these laws and legislations which sometimes slightly differ in terms of how they are implemented. And that could be an additional area of reading that you would do in understanding the Learning Outcome 1. But in Learning Outcome 1, we are going to be studying clearly what are the key legislations, how the policy is formed, what are the guidelines around policies, and how the Department of Health and Social Care sets these guidelines which impact the delivery of health and social care services in England is what we are going to discuss in Learning Outcome 1, Assessment Criteria 1.1. The second part we're going to be looking at is describing the impact of some of these key requirements on the service. Why do we need to follow the Healthcare Act of 2014? Why do we need to follow the Data Protection Act of 2016? Why do we need to follow the Equality and Diversity Act? And what kind of an impact does it have on the services, on the delivery of these services in health and social care sector in England is what we will discuss in Learning Outcome 1. Learning Outcome 2 is going to be focused on understanding the requirements which are necessary for us to work as a healthcare professional within this sector. So what are the key requirements that people need to have in terms of skills, knowledge, academic and vocational skills in terms of their knowledge to be able to work within this sector. And that would be focused on understanding necessary requirements like, when we talk about values, attitude, skills, knowledge, and ethics. And also we will be looking at comparing and contrasting some of these requirements by taking up a role of health and social care professional. Maybe I'll bring across a job description which basically provides the role of a health and social care professional in a particular organization. When I say in a particular organization, what I mean either in the NHS, or we will look at this particular part from a point of view of a private sector setup like a care home, and that would be something that we will discuss in Learning Outcome 2 Assessment Criteria 1.1. Now, in addition to this, what we are also going to do in Learning Outcome 2 is discuss the importance of reflective practice. So when we talk about reflective practice and the importance of reflective practice, we are going to be looking at, discussing on things which basically, when we talk about reflective practice, we look at reflective practice in healthcare. I'm not looking at generically talking about reflective practice, but reflection is a process through which, we look at considering the individual experiences and look at studying those individual experiences to gain insight into how things can be further improved in providing health and social care services within this sector in particular, and what these improvements would mean to the patients or people who are receiving these services. For example, there are lots of trainings and lots of skills development that happens for nurses, healthcare workers, assistants, looking at doctors, GPs. And what is the essence of getting into these trainings is to understand and gain insights into individual experiences, so that when somebody comes in to receive a treatment, or when treatment has to be provided to patients, different patients, how do we take into account their requirements and then provide individualized care which is tailored to their requirements by studying previous experiences of how patients have gone through this particular process. And this helps us in continuously improving the way we provide care to patients, as a healthcare professional. And that is what we are going to be looking at primarily when we talk about reflective practice for a healthcare professional. And this is important because there are lots of reflective models, reflective practice models that we'll be looking at. So things like when we in general talk about, reflective practice in healthcare, we essentially look at reflective healthcare models as well. And when we look at reflective practice models, we will look at the models which are essentially, let's say, utilized from a point of view of healthcare practice by healthcare professionals, and how do we use these models to be able to look at providing better services to our client. And that is what we are going to be looking at understanding as far as this assessment criteria is concerned. So this particular unit is going to be focused on two major learning outcomes. And the focus of studying this unit is to understand how professional practice, is essentially practiced by people working within this sector. And then it helps in the improvement and delivery of care to patients who are receiving this particular service, from various people working within the organization. So when we talk about examples of professional practice, it could be, when I say people working in the dentistry, people working in medicine, podiatry, chiropractic, you look at veterinary medicine, these are all different professions under this sector. And when people working within this sector provide their services, which are bespoke to, the aspect of delivery of these services, that is what we are going to be focused on understanding in this unit. Now, the unit's focus is healthcare practice, and the focus is healthcare professional. So we are going to be looking at these two in detail, and that is what this will help you develop your perspective and knowledge on the basis of when you work as a nurse, when you work as a healthcare professional, when you work as a healthcare worker, healthcare assistant, you work as a part of a team, maybe the triage team in the NHS, or maybe a team in the A&E, or in a GP surgery, or in a community-based service care home, you are going to understand your role quite well, the role and importance of legislation, and the importance of how policy is implemented within this sector, which allows you to work professionally and also understand the ethics side of things which are required for you to be able to implement when providing services to members of public or patients within the sector. Is that okay?
Yes, please.
Yeah.
Any questions on this so far?
No.
Okay, that's great. So let's look at now going into some of the detailing that we would want to pick up by starting the learning outcome 1 of this particular unit. So let me switch you over to the presentation. And what I would do is look at starting off with, say, because the first learning outcome talks about policy and context of policy. That is what we want to understand. What is it first? And this is what we are going to start off by dwelling into from a point of view of looking into what is policy and policy development. Now, when we talk about policy, the word policy itself, the meaning of the word policy itself. So when we talk about the meaning of the word policy and, in terms of what it literally means, we are looking at, principles, we are looking at certain, say, for example, rules and regulations which are being laid down or set that people will follow for the purposes of providing services. And that would be meant by, I would say, policy. Now, if I look at legislation and the meaning of the word legislation, you're looking at essentially laws which have to be collectively considered for implementation for providing these services. And we are talking about these services within the health and social care or healthcare context. So when we look at policy and legislation, we are meaning to be able to look at what is the impact of some of the policies, procedures, laws which have been laid down and how they are used in order to deliver these services to the members of public. Now, when we talk about health service, what we essentially mean by health service is the National Health Service. So when I say NHS, National Health Service, and that would mean that the policies, procedures, laws which have been created by the Department of Health and Social Care and which are implemented in the health service need to be discussed in order to understand this particular unit, which is professional practice and healthcare services. Now, much of the policy that I mentioned earlier that is created, when I talk about laws and legislation, they are generally created within the, context of passing acts in the Parliament. And when we look at passing acts in the Parliament, they go through this route of the laws essentially being discussed. When I say a bill is introduced, I don't know how many of you know how an act or a law is passed in the Parliament, but normally a bill is introduced by the sitting minister or the department minister in the Parliament in the lower house. Then when I say lower house, I mean by House of Commons and the House of Lords. There are two Lords and two houses in our Parliament. So the bill is introduced for a legislation to be discussed by the minister in the House of Commons. It goes through a reading. That means it goes through a discussion. There is first reading, comments and feedback is taken from the members of Parliament. Then the second reading. And the third reading is then it is typed up and it is then passed to the then a vote happens and it is passed and then it goes to the House of Lords. Again, there's a first reading which happens, then there's a vote which happens, and then it is passed by the House of Lords. Then the bill is sent to the monarch, which is in this case King Charles, and it is then approved by the monarch by a royal royal declaration of assent, and then once this is passed through that the readings in the House of Commons and House of Lords, you would normally see that the final bill is produced and then it goes to the monarch, he signs it off, and then it is passed as an act in the Parliament. That act, when passed in the Parliament, becomes a law, and then when that law is passed, that law is supposed to be used by the department to then implement policies and procedures and guidelines, and those are used to create guidelines which departments, various organizations, agencies would follow in terms of delivering the services. So the law and the act which has been passed, in the Parliament, which has become a law, then provides guidelines. These guidelines are used by CQC, King's Fund, NISCE, which is NICE, National Institute of Care and Excellence, some of the other bodies like Social Care Institute of Excellence, SCIE, and they create guidelines and extensive policy documentation, which is then followed in the delivery of services. What services? Healthcare services, care services, old age home services, services which are provided to different members of the public within the country. And that is what we need to be able to understand when we study this particular unit of how policy and legislation is decided, how it is passed, what are the key policies and legislations which are created, and how they are used in providing these services to the national, these healthcare services to the members of public nationally. Now, as I mentioned to you earlier, policies and when these let's say laws are passed, they are passed in the UK Parliament, but there could be further debates of these laws and how they are implemented in the devolved parliaments in Scotland, Wales, and Northern Ireland. And obviously, some part of these laws could be interpreted locally to suit the members of public in that location. Now, let's watch a quick video to understand what are the key organizations which make up the National Health Service, which would be including partners, suppliers, contractors, private and public partnerships which are in place to be able to provide these services to the members of public. So, for example, if I need to do a blood test, I go to the GP surgery. Maybe the clinical nurse would do my blood test. But if I need to undergo a surgery, like a cardiac surgery or a kidney transplant, or some sort of a major surgery, it happens in the hospital. In some cases, if I need to look at extensive treatment in the case of cancer, you go to Christie's Hospital, and that is a private charity, or is a charity essentially which works in tandem with the National Health Service and provides a lot of care services. If you need other forms of services, you would be going to different sides of organizations, and they would then be providing these services to you. But before we get into policy and legislation side of things, what I want to do is basically discuss and show you a video which talks about what makes up the organizations in the National Health Service and how do we look at understanding this from a context of policy and legislation, and where it gets acted, where it gets enacted, implemented is what we want to understand. Is that okay?
Yeah.
Okay,
yes.
So let's look at showing you a video, and let's look at watching this video first to understand what makes up the the setup of these services within the National Health Service. So is everyone able to see the video?
Changes are taking place across the health and care system. What does this mean for the organisations that make up the NHS? How will they collaborate with other parts of the system? And what will these changes mean for you and me? When the NHS was set up, it focused on treating single conditions or illnesses. Since then, our health and care needs have changed. More of us are living longer.
I can't see the video, please.
Multiple conditions that require regular, ongoing care. However, this hasn't been reflected in the NHS's structure, a patchwork of organisations that often work independently from one another. Navigating this can be confusing and can have a negative impact on our experience of care. So, for some years now, health and care staff and leaders have been working to bring organisations closer together to better meet our needs by working in a joined-up way. Primary and secondary care, social care, mental health, and community health services have been seeking to partner with each other in different ways. At a very local level, GP surgeries have been coming together to form primary care networks, groups of practices working together across areas called neighbourhoods. By sharing resources and working closely together with other local people and services, they can provide a wider range of services than a single GP surgery. Health and care organisations have also been working together across larger areas called places, often covering the same area as a local authority, where large parts of the NHS budget are spent. Here, local government, charities, residents, and NHS partners can work together to understand and meet local health needs. But previous laws have prevented services becoming even more joined up. The 2022 Health and Care Act aims to change this and make it easier for organisations to work together. But what do these changes look like? Organisations are now coming together across even larger areas to form integrated care systems, partnerships of health and care organisations that plan and pay for health and care services. There are around 40 integrated care systems across England, and although they've existed for some time, the Health and Care Act gives them legal status, as well as new powers and responsibilities. Integrated care systems are made up of two parts: integrated care boards and integrated care partnerships. Integrated care boards decide how the NHS budget for their area is spent and develop a plan to improve people's health, deliver higher quality care, and better value for money. Integrated care partnerships bring the NHS together with other key partners, like local authorities, to develop a strategy to enable the integrated care system to improve health and well-being in its area. NHS trusts are also coming together to form provider collaboratives, new partnerships that can bring together providers such as hospitals, mental health services, and community services. So how are these new structures funded? Integrated care systems get most of their money from NHS England, which is the national body for the NHS in England, and sets the operational priorities for the health system. It's responsible for the health services you and I access day to day, which are inspected and regulated by the Independent Care Quality Commission. The Department of Health and Social Care sets out what the NHS is expected to deliver for the money it gets from the government, which comes from our taxes. It also holds budgets for some of the other areas that have an impact on our well-being, like public health. Throughout these new structures, local authorities play a key role. They receive money locally and from national government, which goes towards funding a range of services that support our well-being and prevent ill health. So, what does this all mean in practice? The Health and Care Act puts in place a legal framework that enables services to work more closely together, so it's easier for you and I to receive the care we need, when and where we need it. For these changes to succeed, staff and local leaders will have to work with one another differently, alongside key partners in local government, the voluntary sector, and communities themselves. Of course, services face other challenges like workforce shortages, growing waiting lists, and the impact of the COVID-19 pandemic. While the new structures won't fix all these issues, by enabling services to work more closely together and join up services for patients, it's hoped that the health and care system will be better able to meet our changing health and care needs in the future.
Okay, so as you can see, this gives you a good understanding of why and how the NHS is working, how the NHS is shaping up, how the budgeting is done, and what are the key organizations, which are the 44 trusts, the clinical commissioning groups, the CCGs as we call them, essentially make up the working of the NHS, in England in particular. Now, with this context in mind, what we need to be able to look at is what and how is the policy formation or decision-making policy which is created and then implemented because of the requirements of laws or legislation which are passed, and how they impact healthcare services. Now, if we look at a structure which you see on your slide, it talks about how the UK health system is made up of. So you have the UK government, UK Treasury, which is basically the Chancellor and the team essentially provides funding for the National Health Service. And then if you see underneath that, there are 4 devolved countries. So Department of Health and Social Care looks after what are the policies, procedures, and the key legislations and how they are implemented within the National Health Service for England. When you look at Northern Ireland, there's a Northern Ireland executive. When you look at Wales, the Welsh government takes part. And when you look at the Scottish Parliament, the Scottish executive and the Directorate of Health and Social Care, the Department of Health and Social Care in Wales, and then Department of Health and Social Care with Public Safety looks after setting these policies, procedures into action and into place as far as providing services to the members of public are concerned, you and me essentially. Now, as the parliaments have been devolved, the powers have been devolved. So obviously different countries and the parliaments in different countries, Northern Ireland, Wales and Scotland and England, they also then have the ability to be able to, change policy, change legislation, and then implement it according to what is the most appropriate way in which it can benefit you and me or people living in that particular location. Now, in addition to these, when we look at policy and legislation, there is this particular bit which is called the integrated care as a concept which has been introduced in the National Health Service. And this is fundamental and central to all policies and procedures and guidelines which are created by various bodies within the national health sector. And this is something which is important. Now, how people access healthcare is a choice down to them. The National Health Service is absolutely free. Most of the services in health and social care, mental health care, old age and care home and all these services, some of them are absolutely funded by the taxpayer and it's provided for by the Treasury. But people also have the access to choose private healthcare, and this is a choice that they can exercise as per the system which has been, or as per the guidelines which have been laid down by the government in the UK. Now, when we talk about legislation and the word legislation, what all is relevant that we need to discuss, which is specific for health and social care. Now, these are the key legislations that we need to be aware of when we talk about health and social care practice, when we talk about this unit in particular, professional healthcare services and practice. These legislations are what we need to be aware of as far as, our reading, understanding and gaining knowledge is concerned from this particular unit, from the study of this particular unit. So we'll be looking at HASWA, which is the Health and Safety Act, which is what was introduced initially in 1974. We look at the Mental Healthcare Act of 83 and revised later in 2007, the Human Rights Act of 1998, Data Protection Legislation and Regulation, which was introduced in 1998 and then revised in 2016 under the GDPR regulations, which is Journal Data Protection Regulation, the Mental Healthcare Capacity Act, the Health and Social Care Act of 2008, revised in 2014, wherein the 20 different articles were introduced by let's say refreshing this particular act, and they were called the Duty of Candor, the Equalities Act, the Health and Social Care Act of 2012, and the Care Act of 2014. So if I, just bullet label them, these are the 9 key legislations that we are looking at understanding in this particular unit. That is our goal. That is the aim, that we need to understand and study them in detail. And these legislations will lead to policies and procedures. And this is what we will look at implementing in our day-to-day working as a healthcare professional. So if I work within the NHS in whatever role, whether it's an occupational therapist, a nurse, a healthcare worker, a doctor, then somebody who's primarily working in a support role. So essentially what you will be essentially looking at doing is basically looking at following these key laws. And if you are working and delivering some of or discharging some of your responsibilities which are directly related to these laws. You're going to be observing these guidelines to be able to implement them so that you provide effective services which are meeting the guidelines set by CQC, Care Quality Commission, some of the other agencies, and that would conform to the requirements of the law laid down by the Department of Health, or in this case, the Parliament, also the Parliament. Now, if I look at briefly giving you some insight into, when, what, and how it happens in terms of when I look at this particular chart, then I've also created 4 slides, which is for additional reading. And that is what the video also depicted specifically for England. So they are going to be useful for you to go do a bit of reading. And I put 4 slides in for England, for Northern Ireland, for Wales, and then for Scotland. What is it that they mean? So these are basically, when you look at this chart here, this flow chart, which shows the structure, I have just put individual slides in to explain how the structure actually works in each of these devolved nations. So this is for some additional reading that you could do to familiarize yourself with, let's say the working of the National Health Service, the devolution of, the various services which are required to be provided under healthcare, and then how the integration of, let me put it this way, the integrated care model and the choice which is exercised by the members of the public, which can be done when we look at, these 4 different devolved nations. Now, with this background in mind, what we're going to do is go and discuss some of these key legislations, and look at the history of these legislations and how they've come into, practice. Now, what I've done also is, in the Moodle, you will find some individual handouts for these, which are going to be either a Word or a PDF document. And they will give you the detailing of each of these legislations that you need to look at for the purposes of study. And when we discuss the first assessment criteria, I'm going to try and summarize some of these from a point of view of coverage in our discussions today in the session for Learning Outcome 1. Now, obviously, the first assessment criteria talks about identify key legislation, policies, guidelines impacting the healthcare delivery. Now, when we talk about the delivery of services in health and social care, we are looking at some of these key policies and legislation and guidelines which are created by the Parliament, introduced by the Parliament, and then they are used by agencies like NICE, National Institute of Care and Excellence, the Quality Care Commission, Social Care Institute of Excellence, and King's Fund, and some of the other organizations which work very closely with the Department of Health and Social Care, like the Nutfield Trust, Christie's, and they then implement and create guidelines which are to be followed as policies and procedures. A simple example that I would give you is, we are a college, we have lots of policies and procedures which are used in the implementation of delivery of our services to students, staff, employees, contractors, awarding organizations, or key stakeholders that we work with, right? And these policies or procedures are set in stone. And the reason why they are created is that they should act as a guide when we are doing tasks and activities to ensure that we are meeting the minimum requirements set to be able to deliver these services to our students. Similarly, you would see these policies and procedures which are put in place by the Department of Health and Social Care, and they have to be adapted and adopted by various agencies, various outlets which are providing these services to the members of public, whether it's the A&E, whether it's the hospitals, whether it's the GP surgeries, whether it's the care homes. They have to incorporate these policies and procedures and use them to be able to provide effective services to members of public, people like you and me, when we go in and try and receive treatment or, any sort of, if I have a problem and I need to go and see my GP, I need to be able to get those services to the account how they have been set and defined in the policy and guidelines set by the Department of Health and Social Care. Now, when we look at how they came into being, the first thing that we see is back in 1946, after World War II, the National Health Service was established. there was a fundamental decision taken by Churchill, wherein obviously it was all decided that it will be publicly funded. Members of the public in the UK will not need to pay for any sort of healthcare service as far as they are citizens and obviously members of public and residing in the UK. And this is going to be funded by the taxpayer, or in this case the government. Then it led to the creation of the NHS institution in 1950. And there's a document on the creation of NHS which sets out the NHS constitution, which basically provides values, principles, rights that underpin the services which are provided in the the National Health Service. Then the NHS Constitution Act was published in 2010. This is not something that I've written on the slide, but the NHS Constitution and the NHS Act of 2010 actually regularizes the aspect of what is how the National Health Service provides care and implements and provides these services to the members of public. So things like the person-centered approach, the 6 C's of care, the professional conduct which is required by each and every member working within the National Health Service, whether it's doctors, nurses, any sort of profession that you work in, they are all defined in terms of rights and responsibilities which are to be used and executed to be able to provide these services to patients, staff, and members of the public. We also look at the CARE Act. Now, this legislation was introduced in order, when we say the CARE Act in general, when we talk about the CARE Act of 2014 or the Health and Social Care Act of 2012, what we are essentially looking at in this case is talking about the legislations which have been introduced in order to maybe better these services, how they are provided to members of public. So when we talk about the CARE Act of 2014 in terms of its basic summary, what we look at is that this particular act actually set out how adult social care in England should be provided. It requires local authorities to make sure that people living in those areas receive the services, and it also makes sure that these services are provided in a timely fashion and a timely manner to the people living in England. Now, a simple example of this would be when we look at in the news, and I'm pretty sure that you must have also heard that A&E wait times currently are in excess of 4 to 6 hours, depending on which areas we are talking about in the country. And the guidelines set by CQC, Care Quality Commission, is 2 hours or less. Now, if you are requiring an ambulance service, they pick you up and then they take you to the hospital. The wait times are currently in excess of 3 hours, 4 hours, and you can use the NHS website or the BBC tracker because they did an investigation on this on their site to be able to track what are the average wait times in your area or in your town. Now, if these are defined by the CQC as 2 hours or less, and if these services being provided by the local authorities, which is the A&E services, are exceeding that time frame set by the local authority, then in that case it is not meeting the guidelines. So the CARE Act essentially of 2014 sets it in law that how adult social care services will be delivered in England. And it requires local authority to conform to these guidelines and ensure that all necessary steps are taken to be able to implement the guidelines and ensure that, wait times, for example, are less than 2 hours as described or as required by law. Some of the other guidelines and legislation that we need to be aware of is GDPR, General Data Protection Regulation. This was a regulation initially introduced within the EU, and the Data Protection Act of 1998 that we have in the UK was modified and reintroduced in 2016. And this basically looks at dealing with how now data can be stored, retrieved, collected, and used within the department for the purposes of providing and keeping records. Now, as you know, that the data protection regulation of 1998 was quite old, because at that point in time, the internet and internet facilities and central database and recording of information wasn't available. But in the early 2000s, the NHS implemented a centralized computer system, which allows records to be captured and made available to GPs, hospitals, surgeries across the country. Now, over the years, as the internet has proliferated, the usage of internet has increased, and the digitization of records is happening, wherein we are keeping more and more electronic records. The Journal Data Protection Regulation was introduced to ensure that how data is collected, saved, retrieved, and used is following an updated guideline to the original Data Protection Act of 1998. Who are the people who can access the data? What are the access rights available? How the data can be requested to be removed from a particular database by writing to the Data Protection Officer, DPO. And then what is this data used for? NHS does not pass any of your data to any third-party agencies, insurance companies, and it keeps your data, confidential. And if at all, that data needs to be shared, relevant permissions and, checks are made for that data to be shared before it is shared, and the consent of the patient is taken before that data is shared. So these are essential guidelines which are to be followed in any sort of a health and social care setup, whether it's a pharmacy, clinic, care home, hospital, A&E, GP surgery, community center, they will all need to conform to these data regulations, protection regulations, so that data cannot fall in the wrong hands or cannot be used for, cannot be misused for any purposes. Things like advertising, or, in the US, for example, you have private medical insurance. So companies have access to the medical records of the patient, and that is where your premium is determined on, when you take out a policy. But in the UK, this is not the case. And obviously the GDPR regulation protects the patient's integrity in terms of its record. And that is one of the key legislations that we need to be aware of. Then we have guidelines which are set by the National Institute of Health and Social Care Excellence. Now, these guidelines are primarily set, what is the role of the NICE? Anybody, are you aware of, have you heard about NICE? National Institute of Care and Excellence. Have you heard about the, National Institute of Care and Excellence?
No.
Okay.
No.
Okay. So this is a very important non-departmental public body which works as an independent body, but also sets out regulation, also sets out guidelines and legislation in terms of how services can be improved, how they can be provided to the members of public, and how in general, if things are required, changes are required to be made, how they can be suggested and how these changes can be made to ensure that the quality of care which is being provided is not compromised. So in this case, the National Institute of Health and Excellence is a non-governmental body which provides nationally guidance on and advise on important areas related to health and social care. And this particular body, is basically is a body which essentially works in the in favor of the the members of public, because it reviews how care is being provided. It does research into what care is required. For example, in the case of COVID, when we faced the COVID pandemic, NICE released a lot of COVID-related guidelines to ensure that people are kept safe, and the procedures which were out of date, because this was a new pandemic and a new virus that we faced for the first time, they quickly updated some of the procedures which were required to be implemented to ensure that people, staff, members of the public, and people working and providing these services are kept safe, and and at the same time they provided guidelines to be able to improve, to deal with how improve basically services, how they can be used to deal with this particular disease. So NICE is a very important independent organization which helps in driving improvement and excellence within the health and social care system in the UK. It was established way back in 1999, and over the years it has undergone lots of changes. But generally speaking, it was National Institute of Care and Excellence, but it has been, the name has been revised to Health and Care Excellence, because it includes now all the facets of health and social care, including mental health care and healthcare in general. And they produce these guidelines to be able to help improve the quality of care which healthcare professionals deliver to patients. This body, along with CQC, is one of the main bodies which sets the standards and policies and procedures which most setups within the health and social care service follow. And they are guidelines which will help in prevention, diagnosis, and treatment of various types of diseases and dealing with wide range of medical conditions. If there is a new treatment which has to be introduced, if there is a new medication which has to be introduced, it works with MHRA. Have you heard about MHRA?
No.
Okay. So MHRA is another important body, the UK, healthcare system, which stands for Medicine and Healthcare Product Regulatory Agency. So this is a signature body, which essentially, like FDA or an equivalent body in the US, Food and Drugs Agency in the US, actually approves any medication which is introduced in the UK or in the NHS first. So MHRA looks into approving any sort of medication, medical treatment, medical devices, any sort of components which are used for the purposes of providing, treatment to people within the UK. And NICE and MHRA work very closely to ensure, like, for example, when we introduced the COVID vaccines, which were, developed by AstraZeneca, Moderna, Pfizer, Johnson & Johnson, but we have finally taken into account and provided vaccinations to most of the people in the UK, but we have gone in with Pfizer and Moderna vaccine because of the fact that MHRA has tested and checked the vaccine and obviously recommended that AstraZeneca, all these COVID vaccines were approved by them. So they are a signature agency which essentially looks into the approval and the process through which any sort of medication, medical devices, or any sort of services which are introduced in the National Health Service are undergoing some sort of approvals and checks. And they are again working very closely with the NIC, National Institute of Care and Excellence, CQC, Quality Care Commission, and then introduce these medications for the purposes of treatment that can be provided to patients. Now, some of the other acts include Health and Safety Act. Health and Safety Act is a broad act which we need to understand that there is an employee responsibility of the employer and there is an responsibility of the employee working within a particular setup. The employer is responsible for setting out, and ensuring that they provide safe and, clean premises for the people to be able to work. And obviously, when we look at this in the context of health and social care, obviously hospitals, surgeries, any sort of a setup, health and care homes within the health and social care, they have to conform to meeting these guidelines that these services should be inhabitable, should be clean, should be free from any sort of disease or any sort of infection which can either spread or be caused and can cause to or lead to fatalities. And similarly, when we look at people working within this sector, health and social care professionals, they have to ensure that they are following all the relevant standards which have been set for health and safety, not just for their own safety, but also for the safety of patients and other members of staff, contractors, suppliers working within the National Health Service, and thereby ensuring then, say, for example, people which deal with delivery of, organ transplant, blood transfusion, or any sort of equipment, they have to ensure that they are using the equipment in a clean and safe way, in a manner in which it will protect and not harm the patients or the other staff members within the organization or the setup. And that is where this act essentially comes in. There are regular audits which are done. There are risk assessments which are done within any setup, and they could be done every year, every 2 years, every 3 years, to ensure that you're conforming or the setup is actually conforming to the legislation or the laws which have been set for the minimum requirements, and ensuring that services or equipment or the place is safe enough for people to be able to receive treatment. Then we look at the Mental Health Care Act, and this is a legislation which primarily was, introduced in the 1983. And this particular act essentially, covers the reception, care, and treatment of mentally disordered, people who want to receive treatment from the National Health Service. So if you are dealing with people who have a mental health disorder, then there are certain rights and certain regulations that need to be followed in providing treatment and assessment of treatment or services to these patients. And that is what is covered under this particular act. Now, if we detain anybody or if we treat anybody involuntarily, then people have access to this law, which has given them rights, and they can then contest that this is not something that I want to receive, or this is a service that I've not asked for, and they can refuse that service to be taken or delivered. And that is what is covered under this particular act. Now, as I mentioned to you, that these particular acts in tandem with the ones which I showed on this slide, the 9 in particular, there will be a handout which I will provide on Moodle, and that handout will summarize some of these acts in half a page or so and give you guidelines to understand why they are important, how they are used, when they were introduced, and what is their role within the health and social care system that we have within the National Health Service, and how they are important for employers, for organizations, partners, suppliers to be followed in order to deliver these services to members of public, or people like you and me. Any questions on this so far? Any questions?
No.
Okay.
No.
All right. Now, when we look at the second assessment criteria that we want to talk about, in the second assessment criteria, we are going to look at essentially discussing, the impact of these key services and requirements, of basically the impact of these acts on the services which are provided to, say, the members of public. And when we deliver these services, how does it impact when I take into account, say, for example, the implementation of, say, the Data Protection Act, or, for example, anything that I'm looking at from a point of view of, implementing within a particular setup. Now, obviously, there are different ways in which a law or a policy that you implement could have an when you implement something as a process, it could have an output. And what kind of an output you get from an implementation of a policy would depend on, how things are implemented within a particular, organization or at a particular place. So when we talk about, essentially looking at, the impact of these key implementation of these key, legislations or acts that we have discussed, the 9 in particular, we need to understand the, the National Health Service framework. Now, the main framework, when we look at the National Health Service, their main aim is to essentially look at preventing people from dying prematurely. That is one of the key objectives of the National Health Service. The second key objective of the National Health Service is to look at enhancing quality of life for people which could be facing long-term illness or long-term conditions. So people who are diagnosed with cancer are having terminally ill diseases, or diseases which are classed as terminal. That means at some stage they will succumb to their fatalities, or they will succumb to the disease. So the second main aim of the National Health Service is to enhance the quality of life of patients suffering long-term conditions. We look at also, AIDS, for example. This is a disease wherein there is no cure for it. You look at cancer, for example, there is no cure for it. So in some of these cases, the main aim of the impact of these key laws, legislations, which are created by, the Parliament and then enacted in the National Health Service, is to ensure that, one, patients do not die prematurely. Second is to ensure they are able to deal with long-term conditions. Third part is helping people to recover from, conditions wherein they have been ill or they have fallen ill because of an injury. So if you have an accident, you have a fracture, you fall down, then the National Service should be geared enough to help you provide services which will help you get back onto your feet. Things like physiotherapy sessions or treatments which are required in terms of surgery, they are required to be in place to help people recover from episodes of ill health following an injury. The fourth important point that these key legislations have an impact on is that they need to ensure that people have a positive experience from care. And that is where NHS has introduced what is called integrated care as a plan, And that is now a fundamental part of, the services which the National Health Service delivers. So person-centered approach and integrated care ensure that people have a positive experience of care. The last part, this I would say that the impact of the key requirements on legislation is that it helps in treating and caring for people in a safe environment. So when you go to a hospital, when you go to a surgery, you have that confidence that I would receive that service. You have the confidence in the system that I'm going to get a clean, the facilities are going to be clean. It is going to be, hygienic, and it is going to not put me in harm's way. It is going to avoid me going or receiving a treatment which is going to probably worsen my condition, but not worsen my condition, but improve my condition. So these are the three, key impacts which this service or the legislation have. So one is to look at, if I put it this way, the three impacts that we are talking about. So let me just have a quick look. So the three impacts that we are talking about are looking at, effectiveness. We are looking at experience, and we are looking at safety. So when I go to the NHS, when I go to the hospital, when I go to the surgery, when I go to a community health center, when I go to a pharmacy, what I'm looking at is I am, 100% safe. I am experiencing or getting the care that I need, and the care that I'm getting is effective because I'm getting well soon, or I'm getting back onto my feet. And that is what is important in terms of understanding the key impact that these legislations have when we talk about implementing them within a particular setup. Now, if I say that you look at, say the Healthcare Act, for example, of 2012. Now, the Healthcare Act of 2012, essentially ensured that in order to run the National Health Service, the National Health Service in England was broken down into, clinical commissioning groups, or CCGs were created. And these CCGs which were created are made up of doctors, nurses, and other professionals, which work within this sector to provide services of healthcare to, meet patients' need. Now, when we talk about these services, what we are talking about is hospital care, rehabilitation care or service, emergency care, which is provided by ambulance and, emergencies department. And we talk about community healthcare services, and now mental health care services. Now, when these are provided, they are provided because we have ensured that the key legislations have been put in place which provide and create the structure through which these services can be delivered. And that is what we need to understand when we talk about the impact of the legislation on delivery of these services within the health and social care sector. So what I've done on this slide is I have explained briefly how these services are funded. So the NHS is funded through taxation and obviously government funding. The NHS budget is roughly in the region of £200 billion every year. And obviously any, requirements which, like the COVID pandemic had put, government provides additional funding to be able to deal with these requirements. Now, when we talk about guidelines and when we talk about new legislation which is created, they are created primarily because if we are dealing with a new pandemic, in the case of COVID pandemic, NICE created, National Institute of Care and Excellence created new guidelines to deal with COVID pandemic, how prevention could be done, how diagnosis could be done. So the Department of Public Health, PHE, Public Health England, this is another department which you must have heard about, PHE, Public Health in England, came out with this particular, guideline of space, hands, space and face. That means you need to wash your hands, you need to have 2 meter social distancing, which was space, and then face, which is covering your face with a mask, face mask, and that helped prevent, COVID infection. So when we talk about PHE, and we talk about these main bodies like NICE, CQC, they come out with these new guidelines and implement these key requirements which have to be followed in order to ensure that the members of public get effective care their experience in receiving this care is good, and they are guaranteed safety when they are dealing and obviously receiving this care within the system. So overall, when we talk about the impact of key services that we generally look at in terms of the key legislations which have been implemented within the National Health Service, they help in ensuring that patients are kept safe, they receive effective treatments, and last but not the least, they feel safe while receiving these treatments and care from the National Health Service. So the key responsibility of the legislation is to ensure that the care being provided is meeting the required outcomes set by the government and the Department of Health and Social Care. And thereby, an example that we see all in front of us is that using a structured approach of ensuring, lockdowns, by ensuring vaccination and ensuring, the face, space, and covering of your mask, hands, face, and space, the government was able to bring a control onto the pandemic of COVID pandemic. And as a result, now we are, dealing with this pandemic, or we have gone out of this pandemic and getting back things to normal. So this has happened because of the introduction of key guidelines and legislation, which has been done by CQC, by NICE, by Public Health England, and they have then helped follow the, members of staff, people who work within the setups, different setups, follow these guidelines to be able to overcome the pandemic. And that is where successfully we have come out of the pandemic. And now we are able to deal with, this as an ongoing situation, rather than looking at lockdowns and, essentially taking drastic measures to be able to deal with something which has not been faced before in terms of, COVID as an example. So is that okay? Has that been understood?
Yes.
Yes.
Good stuff. Any questions on today's discussion so far?
No.
Okay, so this obviously helps us complete learning outcome 1 of this particular unit, Introduction to Professional Healthcare Service and Practice. So basically healthcare service and practice. And we'll meet up next week, same time, to cover learning outcome 2 for this unit. So until then, what I would suggest is go through some of the handouts, this presentation that I've put up on Moodle, and then read into to understand the handouts essentially in a bit more detail of what we have covered today in today's session.
Okay.
And if you think of any questions, or if you have any questions at any given stage, feel free to come back to me, via email. And that could be done primarily by, sending an email to LearnerWork, and I would be able to get back to you pretty much straight away. Now, there is some additional reading that you can do to understand, some of the key legislation. One of them I have put in as further reading here. And this particular link, if you open, will give you a broader understanding of how legislation is working and evolving in the National Health Service. Okay, so let me just quickly switch you over to the website just to show that to you. And that would be additional reading for Learning Outcome 1. This is the site, and it talks about the Health and Social Care Act, the 6 key questions, and why, acts are revised, why the laws are revised from time to time, is because that there are changing requirements, obviously moving goalposts. So we didn't have a COVID pandemic. So obviously COVID pandemic that we have faced as a group, as a society, as a country, has mandated that we need to make some changes in the way we deal with this, and they are then leading to changes in legislation and changes in the implementation of policies and procedures. So this is one such article which you can read on the King's Fund website, which talks about Health and Social Care Act and the 6 key questions and how this is now changing. So Health and Social Care Act that we discussed was introduced in 2012, but this act has now been revised in April of 2022. and why it was revised, what are the changes, what it brought about, and why it was required to be done is actually discussed in this particular article. It's a 10-minute read, and I would suggest that you need to read this article because it will answer questions like what are the main changes being brought about in the Act, why they were necessary, will this Act lead to greater involvement of private sector, what is the role of the ministers, and how does it affect the day-to-day functioning of the National Health Service with these changes being brought across, what kind of difference will it make to the patients with the changes being introduced, and does it tackle some of the big challenges which were required to be taken into account after the COVID pandemic, and is the Act now suitable, and does it provide suitable and effective guidelines to be followed for the purposes of providing these services to the members of public. That is what is actually discussed in this particular article, and it takes you through the process of how these changes were introduced and the revision in the Act was done. So I would suggest go through this, and this will directly give you a good understanding of policy and legislation impacting health and social care, which is what we've covered in thorough detail today, in terms of our discussion for Learning Outcome 1. And I will see you next week to discuss the second learning outcome. Until then, take care and thanks for joining.
Thank you.
Thank you.
Thank you.
Thank you. Bye.
Bye.
Thank you. Rama.
Bye.
Yes.